Today's tutorial will be about keys to giving a more comfortable injection. Your patients will greatly appreciate you using these little pointers to make the injections less painful in a clinical setting. So what are some things we can do to make injections, to make shots more comfortable in our clinic? Well, there are a few things. One is in our clinic we usually use a 30 gauge needle. So a very small gauge, 30 or smaller gauge needle. And we usually use what's called the gate control theory of pain. So there are different ideas about how pain is transmitted along the nerve fibers. Well, in the gate control theory, the idea is that signals have to pass through small gates in the nerves before they arrive at the brain and are perceived as pain. So in the gate control theory, we try to overload those nerves with different types of signal. So prior to giving a shot, we may ice the site to at least partially numb the skin. If you rub the skin in the region that's going to be given a shot, that will help. If you pinch the skin to a degree, that will help. And these signals will overload the nerve gates, and so the shot is perceived as less painful. And an example of this is when we bump our shins or bump our heads, we usually rub our heads, and that's because the idea is that that's the gate control theory of pain. We're overloading that nerve, and so the bump doesn't hurt quite as much. So let's take a look. Here's an example of us giving a shot. We're about to excise an area where a skin cancer is diagnosed, and you can see we're rubbing the skin in this region and then pinching the skin, again trying to overload those nerves. We're going to start proximally and then work our way distally along the site that's going to be excised. So we make a small injection, just get the tip of the needle in place, and we're going to make a wheel of raised anesthetized skin in that area, and then from that wheel we're going to move the medicine, if you will, around the site. We'll watch a video about that in a minute. Well, here is an invention that was developed for children. It's called Buzzy, and you can see it comes with an ice pack, and the little bumblebee will actually vibrate. And so you put the ice pack and the vibrating bumblebee over the site that's about to be injected. Leave that on for about 30 to 60 seconds, and that overloads the nerves. And then you'll just slide the Buzzy device proximally, and then you give your shot, and that'll make injections much more comfortable. Here's another technique. It's ethyl chloride spray, and this is just a chilling spray that will again help numb the site prior to giving injections, and your patients usually appreciate that. I find this especially useful for injections given on the palms or the soles or the digits, where it's much more sensitive. EMLA, this is a topical anesthesia. There are various different types of topical anesthetics that may be used prior to procedures. EMLA is applied to the region that's going to be injected or removed. It's left in place for about an hour, and so you apply a thick coating of EMLA. What I tell patients is about a cake frosting amount. So you spread a thick coating on and then cover it with something like saran wrap. You occlude it and tape that in place and leave it on for a good hour plus prior to the procedure, and that will actually numb a region to some degree, so an injection is more comfortable. So what are we going to do? Here's our injection technique. Well, we're going to start in one area. We're going to start proximally, and then we'll get some degree of a nerve block that way. You can see, number one, we're going to inject into the first star, and we're going to raise a bit of a wheel, a bleb of anesthesia, of lidocaine, and you can numb quite a large area from that first injection. Then we're going to withdraw the needle and then redirect it more parallel with the skin. So we're going to follow the arrows and move on to the stars listed in the number 2 site. And then once we move the medicine, advance the lidocaine very slowly to that region, then we can withdraw the needle and inject in the 2nd star and 3rd star and 4th star and so on all the way around the site. And this way the patient will feel only the initial stick. If you infuse the medicine very slowly, inject very slowly with the lidocaine, it will burn much less. The rate of infusion of lidocaine really determines how much stinging and burning the patients are going to feel. And one of the lessons we learned when I was a resident is patients will always remember how much you hurt them. And so we want to make their visit to our clinic as pleasant as possible. And there's a lot of anxiety over procedures, and if we can reassure them that yes, this is going to hurt a little, but we're going to do our best to make it as comfortable as possible, your patients will greatly appreciate that type of care. Well, let's take a look at our video of an example of numbing a region. We're going to start proximally with our injection, and we're going to create a wheel in this region, and then working through that wheel, we're going to work the medicine, the lidocaine, all the way around the site. So the patient should really only feel the initial injection. So we go in, it's bevel up, we go into the skin, and we inject. Now we're going much more quickly than we normally do. You can see that we're raising a wheel of skin here. Once we raise that wheel, then through that same injection, we're going to go more parallel with the skin and slowly advance the needle. And as we advance, we inject a little. We advance, we inject a little. We advance, we inject a little. And we can work the medicine all the way around through one injection. Now we redirect. You always have to remove the needle to redirect. And inject, advance, inject, advance. Now you want to go much more slowly to keep it comfortable for the patient, because the rate of infusion of the lidocaine is what is going to determine how much discomfort we have.